As a neurologist, we talk about the brain all the time, but for today I want to focus on how cool the nose is and why it's an important delivery for migraine medication. When we talk about nasal anatomy, it's important to know that all areas of the nose aren't the same. The top of the nose, the back of the nose is really rich in both venous and arterial access. This, of course, is important because when you put medication in the anterior vestibule of the nose, it's not ideal for medication absorption. When we look at the lower nasal space, that anterior vestibule of the nose, it's just not designed for medication absorption. It's got squamous epithelium that acts almost like a raincoat and won't let medication penetrate. Now, if we focus in the upper nasal space, you'll notice that the actual cells are different. These are columnar epithelial cells, and they've got cilia on them. But what's interesting is that the cilia in the top of the nose are non-modal, which means that they don't have a beating-like wave to move medication away. And in my opinion, this is the most ideal area to deliver medications because these columnar epithelial cells are covered with mucus and able to absorb medication best for any spot in the nose. If you can get medication to the top of the nose where these blood vessels are ready to absorb medication, you're going to get your optimal effect. When we talk about the upper nasal space and why it's so ideal for our migraine patients, we know that the upper nasal space is designed for phenomenal medication absorption. But we also know that medications that go to the upper nasal space avoid first pass phenomenon in the gut and avoid you going through the liver to metabolize the medication down and therefore giving you lower side effect options. And the third part about this is that medications, when they're delivered in the upper nasal space, are also going to allow you to get past gut slowdown, which occurs when people have their acute migraine attacks. So we know that traditional nasal atomizers has a puff of medicine that goes into the front of the nose in what we call the nasal vestibule. And the reason why that medicine can't go to the top of the nose is because a portion of the nose called the internal nasal valve. The internal nasal valve isn't an actual structure. It's more of a stricture in the nasal passages, but it stops typical aerosolized medications from getting to the upper nasal space. This becomes a huge barrier for delivering medicines to the top of the nose. And the pod technology with Trudhesa gets medicine past this internal nasal valve and up to the target where it's going to be best absorbed.
Indication and important safety information. Indication. Trudhesa is an ergotamine derivative indicated for the acute treatment of migraine with or without aura in adults. Warning: peripheral ischemia following co-administration with potent CYP3A4 inhibitors. Serious and/or life-threatening peripheral ischemia has been associated with the co-administration of dihydroergotamine with strong CYP3A4 inhibitors. Because CYP3A4 inhibition elevates the serum levels of dihydroergotamine, the risk for vasospasm leading to cerebral ischemia and/or ischemia of the extremities is increased. Hence, concomitant use of Trudhesa with strong CYP3A4 inhibitors is contraindicated. Limitations of use. Trudhesa is not indicated for the preventive treatment of migraine or for the management of hemiplegic or basilar migraine. Contraindications. Trudhesa is not recommended in patients with concomitant use of strong CYP3A4 inhibitors, such as protease inhibitors, for example, ritonavir, nelfinavir, or indinavir, and macrolide antibiotics, for example, erythromycin or clarithromycin. Ischemic heart disease or coronary artery vasospasm, uncontrolled hypertension, known peripheral arterial diseases, sepsis, following vascular surgery, or severe hepatic or renal impairment, hypersensitivity to ergot alkaloids, concomitant use of other 5-HT1 agonists, for example, sumatriptan, or ergotamine-containing or ergot-type medications within 24 hours, concomitant use of peripheral and central vasoconstrictors. Warnings and precautions. Trudhesa may cause cardiac events. Cardiac events in patients with risk factors of coronary artery diseases. Consider administration of the first dose of Trudhesa under medical supervision, including the use of an electrocardiogram. Cerebrovascular events. Cerebrovascular events, for example, cerebral hemorrhage, subarachnoid hemorrhage, and stroke, have been reported, particularly with dihydroergotamine mesylate injection. Vasospasm, elevated blood pressure. Dihydroergotamine may cause vasospasm or elevation in blood pressure. Fibrotic complications. Rare cases have been reported following prolonged daily use of dihydroergotamine mesylate. Administration of Trudhesa should not exceed the dosing guidelines or be used for chronic daily administration. Medication overuse headache. Detoxification may be necessary. Preterm labor. Advise pregnant women of the risk. Local irritation. Local irritation has been reported following administration of Trudhesa. Most common adverse reactions. Most common adverse reactions, incidence greater than 1%, were rhinitis, nausea, altered sense of taste, application site reactions, dizziness, vomiting, somnolence, pharyngitis, and diarrhea. Use in special populations. Pregnancy. Available data from published literature indicate an increased risk of preterm delivery with Trudhesa use during pregnancy. Lactation. Patients should not breastfeed during treatment with Trudhesa and for 3 days after the last dose. Please see the Trudhesa full prescribing information, including boxed warning and medication guide. The risk information provided here is not comprehensive. The FDA-approved product labeling can be found at www.trudhesahcp.com or 1-800-555-DRUG. You can also call 1-833-TRUDHESA, 1-833-878-3437 for additional information.